one of the frustrations that I have in psychiatry as a field, I'm really interested in doing psychiatry, but one of the things that I find challenging is that it's a syndrome-based diagnostic system. Because the brain's so complex, we don't have like etiological classification of disease. So like an infection, we know the bug causes the infection, we know the inflammatory response. With schizophrenia, we know some of the genes, we know some of the environmental stresses, but we can't predict it. There's no predicted test, there's no blood test for it. And there's probably like, I don't know what your thoughts are, but there might be like multiple different diseases in the syndrome of schizophrenia. Well, I guess that's an interesting question. Do you think there's multiple diseases that could be schizophrenia? In 100 years' time, will there be like 5 different diseases?
Look, I think it's more likely that it's a constellation of different diseases rather than a single thing. That we come up with. This like a bacteria that causes it.
But from that, do you think that in the next, how long do you think it will be before we can classify psychiatric disease etiologically, like until we understand the brain to that point?
Well, I mean, I suppose this is a question for academic psychiatry and neuroscience. That's probably beyond what I understand. But well, I suppose if you looked 100 years ago in psychiatric hospitals, you would have found people with epilepsy and you would have found people with neurosyphilis. And those two conditions actually did have fairly unitary causes that were able to be treated, and then therefore we don't have many people left with epilepsy in our psychiatric hospitals. We do have some, and so in the forensic hospital we have the occasional patient that has been sent to us with epilepsy as their primary diagnosis. It's possible that we find something that just we haven't been looking for, and that's there. But I think that the weight of evidence suggests that because the organ that's being acted on is infinitely more complicated than the other organs that are being acted on by outside influence, there's probably going to be a difference there with the brain as to other organs. This I don't tend to worry about too much because it means that psychiatrists are not going to be readily replaced.
That's true.
While I think that if there was some sort of very quick and easy way to alleviate the suffering of psychiatric patients, I would be all for that if it could happen. The fact that things are syndromes doesn't mean that doctors can't be involved in them, and making that the diagnostic formulation around those syndromes doesn't mean that we then can not have empirical treatments for those syndromes, which psychiatry has been embarking on that evidence-based program for a long time, and has moved away from a very has moved more towards the rest of the Academy of Science in that way than perhaps in the past it had been. It still leaves, and I think this is probably true of whether you're treating high blood pressure in one patient or another patient, you're still going to treat it differently. You're still going to need to have that good interviewing skills. You're going to need to have good motivational skills to help the patient manage their own ailment, whatever it is. And you're going to still need to have clinical judgment about what pills you might give or what lifestyle advice you might give. So I think even where we've got a simple cause, it's usually not simple when you track back and look at that. When it hits when the ailment hits the patient, that's where the medicine comes in. And so psychiatry, yes, there's a bit more that we can't use really simple algorithms to come up with our treatments. But that being said, there's lots and lots of really effective treatments in psychiatry. And I think that's, when you're in medical school, you probably don't notice that so much.
Yeah. Hey team, thank you so much for checking out that highlight clip from the Doctors Getting Coffee podcast that I run. If you want to see more clips, you can check out my YouTube channel, or if you want to listen to the whole thing, check out your favorite podcast app. If you want to support the podcast, consider buying us the next coffee at buymeacoffee.com/Dr. Sil. You can also join us as a YouTube member or a Patreon and get access to the full video podcast episode. Or you can just jump onto our Discord server and we can chat one-on-one. Thank you for your support, and I'll see you in the next video. Bye for now.